Hi, my name is Mina and today we're going to talk about malignant melanoma with Zosteriform metastases. The malignant melanoma with Zosteriform metastases has a high tendency to metastasize to the skin. In autopsies, serious patients who die with melanoma as a direct cause of death or with a consistent melanoma at the moment of death. Up to 50% of incidents of cutaneous metastasis was found.
The progression to melanoma is still poorly understood, and there's a lot of research going into it. Our current understanding is that melanoma arises either from an existing mole, called a dysplastic nevus, or de novo, meaning a normal skin. As the melanoma grows, it tends to have a horizontal growth phase, meaning it will just involve the epidermis, the top layer of the skin, and later will have a vertical growth phase, which means it will start invading into the dermis and underlying structures. Once the invasion has happened, the melanocytes that form the melanoma can travel through lymphatic channels into lymph nodes and the other parts of the body, like the liver and the brain. When this happens, it's called metastatic melanoma. Metastatic melanoma is the most difficult type of melanoma to treat. Depending on where it has metastasized, the mortality rate changes anywhere from 20 to 50%.
Malignant melanoma with Zosteriform metastases. It is a tumor that is known for its ability to metastasize to the non-visceral sites of such as skin, subcutaneous tissues, and regional lymph nodes in up to 42 and 57% of cases.
Hello, I'm Dr. Chris Schock with Online Derm Clinic. Today's tutorial will be about melanocytic nevi, or more commonly known as moles. We hope you find this tutorial helpful. Well, melanocytes are what make up moles, and melanocytes are the cells within our skin that give us color. Clusters of these melanocytes make up melanocytic nevi, or moles. The average adult has about 20 moles, but if you're fair skin, you're probably going to get more, or if you have a genetic predisposition, a family history of lots of moles, then there's a good chance you will get lots of moles. The degree of sun exposure, how much sun exposure you get, will influence the number of moles you will grow. And the more sun, the greater the risk that one of these moles may turn into a cancerous growth. Most of our moles occur by about the age of 20, and there are several different types of moles that we talk about. Now, if you have a mole present at birth, it's called a congenital nevus, or more commonly known as a birthmark. The acquired nevi, these come on after birth, and they're a junctional, compound, and intradermal. These are the more common types, and moles tend to mature through these different types of moles. So they start out as junctional in most cases, so they're smooth and brown. Over time, the melanocytes will sink deeper into the skin, and when that occurs, the skin will raise, and this is a very gradual change. As the skin raises, the mole may fade in color or change in color, and then it's called a compound nevus. So a dome-shaped kind of brown mole is often a compound nevus. So the melanocytes are present within the top layer of skin and in the second layer of skin. When the mole cells, the melanocytes, are all in the dermis, the second layer of skin, they're called intradermal nevus, and so that's the third stage of maturation for most moles. Now, if you noticed, all of these moles, they're round to oval, they're fairly uniform in color, so this is what we want to see in a typical melanocytic nevus. Well, the worry is that melanoma can sometimes develop within a mole. They can also develop de novo, just on normal skin. You may get a brand new spot that's melanoma from the very beginning, but about 50% to 70% of the time, depending on what study you read, melanoma cancer can develop from a pre-existing mole. About 1 in 58 Caucasians in the United States will now get melanoma in their lifetime. That risk was about 1 in 1,500 back in 1930. So our habits, our culture of sun-seeking and the use of tanning beds has greatly increased our risk for melanoma. Now, 1 in 1,000 risk for African Americans. If you have dark skin, you have natural sun protection, and so your risk for melanoma is lower. 1 in 200 for Hispanics, you can see. When diagnosed early, if we catch a melanoma cancer early, the cure rate approaches 100%. That's why so much information is put into early detection. Once you have spread, once you have distant metastasis, also known as METs, your survival is about 6 to 9 months. So what causes it? Well, again, sun exposure is one of our leading causes. And so what I tell my patients is that over our lifetime, we can only accumulate so much sun damage. Once we exceed that amount, your risk for skin cancer is very high. Once you fill up your sun cup, we can't dump it out and start fresh. We just have to move forward and really watch closely. So the goal is, number one, try not to let your sun cup get full. And if it is full, moving forward really protects your skin from any further sun damage. So what are we looking for in moles? Well, we have these general guidelines that were developed, the ABCDEs of melanoma. And so we're looking for the ugly duckling mole, one that just doesn't look quite right. It doesn't look uniform in shape. It's not uniform in color. It breaks one of the rules. So if a mole breaks any one rule, we want to see it. So A is for asymmetry. So does one half look like the other half? If the sides don't match, you need to see your dermatologist. B is for borders. Funny scalloped borders, that mole should be checked. In nature, we like to see round to oval moles, and they should be C, uniform in color. And D, diameter, they should be 6 millimeters in size or less, so about the size of a pencil eraser. And they really shouldn't make any rapid changes. And they should be asymptomatic. So if a mole is itching, burning, stinging, growing, changing, new color, new shape, new size, you should bring it to your dermatologist's attention. Let's take a look at a few melanoma skin cancers. Here you can see it's greater than 6 millimeters in the shape. This has those scalloped borders. It is not round nor oval. Here's an amelanotic melanoma. This melanoma is not black. It's pink and red. It even has some whitish color at the top. So we need to be on the lookout for any mole, whether it be pink, black, brown, red. That doesn't matter. Color variation, is it growing? You can see that this is greater than 2 centimeters in size. Here's a melanoma with a more classic picture of a melanoma. It's got the scalloped borders, and it's got color variation. And again, it's greater than 6 millimeters. So we want to look for these patterns. Is there something unusual lurking about around your moles, or in between your moles, or maybe within one of your moles? Is there a rat? I don't know if you can see, it takes a little imagination, but my son pointed this out to me in the sky. Sometimes you think it's just a pretty day and nice clouds, but here if you look, it looks kind of like a rat floating through the air. So we want to recognize, is there a rat lurking about amongst our moles? So be on the lookout. If you notice something strange, come see your dermatologist. As always, thank you for allowing us to participate in your care, and we hope you found this tutorial.
Malignant melanoma with Zosteriform metastases. Metastases in a visceral sites can be divided as follows. First, lung, then is from 18 to 36%, then the liver, that is from 14 to 20%, then brain, that is from 12 to 20%, and bone, that is 11 to 17%.
Dear 16-year-old me.
Dear 16-year-old me.
Dear 16-year-old me.
Please don't get that perm. It's not as awesome as you think it's going to be.
You have to actually practice in order to learn to play guitar.
Whiskey tastes even worse on the way up.
Dear 16-year-old me, there's going to be a new set of Star Wars movies. Don't watch them. They ruin everything.
Dear 16-year-old me. This is where they took the cancer out. It was something called melanoma.
It's called malignant melanoma.
Malignant melanoma.
Malignant. That's not a very friendly word.
You'll be diagnosed when you're 28.
18.
36. 29.
22.
It's a tumor that starts in your skin cells, the cells that give your hair and skin color.
It's not just skin cancer.
Well, it is.
Well, it is.
But not just the...
Cut it out and it'll be fine kind, unfortunately.
It's the kind that you have to catch before it spreads.
Because it spreads so fast.
So fast.
To places like your liver, your lungs, your brain.
Yours will be a really rare kind in your left eye, and that's when you'll find out.
That melanoma can show up on your tongue, the palms of your hands, and the soles of your feet.
Your doctors will tell you you're lucky that you caught it early.
Yours will tell you that you need aggressive treatment.
I'll have to tell you it might take a year of chemotherapy.
And you'll need to do some of the injections yourself.
Dear 16-year-old me,
You're doing okay.
you're strong.
But there are some things I want you to know.
I wish I'd known.
That one bad sunburn before you turn 18
doubles your chances of developing melanoma.
That fair skin and red hair means that you're at a higher risk of getting it.
As if ginger people didn't have enough problems.
That you're at higher risk if you've got more than 50 moles.
And if you have a weakened immune system or a family history of skin cancer.
I want you to know the outlook is very good if we can catch it early.
But you have less than a 10% chance of surviving more than 5 years if we don't.
Dear 16-year-old me.
Spend more time with family. They mean everything.
If I had one piece of advice for you, don't start the tanning bed. I know you want a healthy glow, but it's going to double my chances of getting melanoma.
Sunscreen.
Yes, I agree. It's a huge pain in the ass, but so worth it. Please.
Your skin's like an elephant. It never forgets.
Dear 16-year-old me, helping spread this message is how you'll honor Glenna's memory. At 16, she's already an incredible lifeguard. She loves the sun and the beach and tanning, but she just doesn't know.
She'll be diagnosed when she's 22 and will lose her battle when she's just 26.
I want you to know, because it's melanoma that's going to take the strongest man you know, your best friend, and the love of your life.
Dear 16-year-old me.
Don't be afraid. This isn't about being afraid.
I want you to be aware
that melanoma is a young person's disease.
It is the second most common cancer in children and teenagers, and one of the most common in young adults. And it can be deadly.
I want you to know you're not helpless.
This is a cancer that shows itself
right there on the outside of you.
Start checking your skin.
Please check.
Get to know your skin.
Get to know your skin.
Start checking your skin.
If a new mole shows up,
or if when you have starts to change color, or size, or shape, or feels different.
If something seems out of place, get your doctor to have a look as soon as possible.
Know what to look for and get help. These are all signs your skin could be developing cancer.
You brush your teeth every day, maybe even floss.
Okay, we both know you don't floss.
But just once a month, I want you to check.
It takes 10 minutes.
10 minutes.
Dear 16-year-old me, I do realize you're not actually going to see this, but someone else will, and it'll make a difference to them.
Dear someone else.
Dear somebody else.
If you're watching this,
send it to a 16-year-old you care about.
Send it to anyone who was once 16.
Or soon will be 16. Send this.
And check yourself. Educate yourself.
You can download tools and information about melanoma here.
Share this link.
Tweet this link.
Post this to your Facebook.
The Zosteriform metastasis are a rare form of metastasis in melanoma. There are several theories that try to explain the rare melanoma discrimination, but none of it is proof. Thank you. Ya, crear un video falso.
section of a brain. Notice it's not as pink as it usually is because it's not stained with eosin and hematoxylin in the usual way. They kind of let back heavily on the eosin, and instead they used another stain. Notice also that in the